Hello, I'm Michael Davey. I've been a doctor for 28 years and I'm also a qualified counsellor who runs emotional wellbeing workshops for healthcare professionals. In this short video, we will explore why it's important not to neglect self-love during the Covid-19 crisis. Doctors and nurses have many great attributes. 3 of these are a willingness to take responsibility, a focus on the needs of others, and a striving for high standards in our work. These are very admirable, and they are the reasons for the trust that people put in us. Research suggests that these attributes stem, at least in part, from 3 areas of the psyche that are heightened in many healthcare professionals. These 3 areas are guilt, low self-esteem, and a persistent sense of failure. And this is highlighted in the research of Dr. Glenn Gabbard in 1985 and more recently by Dr. Claire Gerada in 2018. So let's look at each of these in turn, starting with guilt. Guilt is the emotion that obliges us to take responsibility for our actions. Low self-esteem leads us to hold people and their needs above our own, and a persistent sense of failure is a driver for high standards in our work. Thus, guilt, low self-esteem, and a persistent sense of failure form a triad, and this makes us better doctors and nurses. So is there a problem? Well, yes, there is. As well as an upside, each part of the triad has a downside that at times of stress can affect our emotional well-being, and so it is timely to look at it now in the light of the COVID-19 crisis. Guilt leads us to take responsibility for things when they go wrong, even when they're out of our control. For example, you have 2 patients requiring a ventilator, but only 1 ventilator available. It's a catch-22. Whichever patient you decide to give the ventilator to, you are denying it to the other. You are not responsible for the number of ventilators, nor for the high demand. So objectively, you have no reason to feel guilty. But of course, you do feel guilty. Emotionally, you cannot distinguish between deserved and undeserved guilt. They both have an impact on your sense of well-being. Now, unfortunately, undeserved guilt has the greater impact. This is because to deal with our guilt, we need to be able to make amends. With deserved guilt, we can say that we're sorry. We can put things right, or at least compensate someone for our mistake. With undeserved guilt, we are not usually able to make amends because the circumstances are outside of our control. So we end up holding the guilt for far longer. And I have met doctors who have held undeserved guilt for decades. Now let's look at low self-esteem. As I said earlier, low self-esteem leads us to hold other people and their needs above our own. Whilst this is admirable, it does mean that when you are busy and overstretched, your own needs are neglected and on occasion almost entirely overlooked. So, not taking your breaks, not eating and drinking adequately during a shift, not taking a full entitlement of annual leave, etc. are common amongst doctors and nurses. In short, self-care is neglected. It is not uncommon for people who choose caring professions to hold the unconscious belief that I can only see to my needs once I've seen to everyone else's needs first. The problem is, of course, that in healthcare the needs are never ending. So what about a persistent sense of failure? What is the problem here? Well, this part of the healthcare professional's psyche motivates us to keep our standards of care high, but all too often it stems from an unconscious belief that I am not good enough. To try and deal with this negativity, there is a tendency to become overly perfectionist, running faster and faster in the hamster wheel of our working lives, trying to feel good enough to allow ourselves to slow down, but of course we rarely feel able to do so. The inevitable consequence is burnout, something of which I have had personal experience. So, the triad of guilt, low self-esteem, and a persistent sense of failure has a negative impact on our emotional well-being. So what are the solutions? Well, this talk will have increased your awareness of the triad. So learn to spot it when it's at work in you. Celebrate who you are and what you bring to your work, and mitigate any negative impact by choosing to love yourself. In other words, self-love. Self-love has 3 parts to it: self-acceptance, self-compassion, and self-care. Self-acceptance challenges my unhelpful beliefs. I accept myself as I am, no ifs or buts, totally unconditionally. Self-compassion counteracts my critical thoughts and negative feelings such as guilt. I choose to treat myself with gentleness, kindness, and compassion. And if I hold any sense of guilt, deserved or not, I choose to forgive myself. And self-care cultivates caring behaviour towards myself. I choose to allow myself the care that I both need and deserve. Proper breaks for food and drink, taking rest when I'm not at work, exercise, sleep, connection with family and friends, and slowing down to pamper myself too. So in summary, doctors and nurses often have a triad of guilt, low self-esteem, and a persistent sense of failure. This helps us to do a really good job, but it has a negative impact on our emotional well-being at times of stress. Cultivating self-acceptance, self-compassion, and self-care is the key to mitigating against this. Self-love is at the heart of a contented and flourishing life. I hope you found this useful. You will find other videos and resources on my website, drmichaeldaviewellbeing.co.uk. And thank you for all that you're doing. Stay well.